Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Middlesex-London Health Unit's Medical Officer of Health, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Happy to be joined by the media this afternoon as well, and a reminder, if you have not yet submitted your questions, you can do so using the question form here on Microsoft Teams. Just click on the icon of the text bubble with the question mark, and when you do submit your questions, if you could please indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those tuning in this afternoon on Global News Radio 980 CFPL, those who are watching on Rogers Television as well as the Rogers Facebook page and YouTube channel, and those who are watching us on the CTV London website. Let's get to the opening remarks, and we'll start today with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. So on the enforcement front, it was a surprisingly busy and disappointing weekend for bylaw officers. A number of gatherings of private residences were reported, and clear violations were reported, 4 of them, with several charges being issued. And one in particular, over 25 individuals were observed. Stop it. That's just nuts. And it's not thoughtful to all of Londoners and folks from Middlesex County. So look, at this time, I don't have a lot more details, but 4 of those occurrences remain open for further investigation. And while we have laid a number of charges, more will come. Sadly, more will come. But thankfully, these types of occurrences tend to be the exception rather than the rule. But still, come on. To have this many instances over a single weekend, this close to trying to get this dealt with, that is truly disappointing. And we're getting close and closer to a time where these gatherings of this type are going to be safe and when they're going to be allowed. But now is not that time. So my concern is when people take shortcuts or flout the rules, we really truly run the risk of setting back all the remarkable progress we've made over the last several weeks. Come on, people, we can do better. We're on the verge of having what may well be a very good and perhaps even relatively normal summer. So let's not jeopardize that, especially when we know better. Elsewhere, we saw the news earlier today that while many regions across Ontario can begin rebooking second dose appointments as of today, it's not the case here in London Middlesex. The health unit has said that will begin Monday, June 7th, potentially sooner. And the reason for the temporary delay is vaccine supply. So we're going to continue to make the case for greater vaccine supply, and I remain hopeful that the deficit will be addressed sooner rather than later. But in the meantime, we're going to continue to encourage people to get their shots. Let's get those shots in arms as fast as we can here in London and Middlesex. It is frustrating, however, that if we were provided ample supply, we could be administering more than twice as many shots as we do right now. Still, as we await that accelerated second dose schedule, let's all do our part to encourage everyone to get their first dose and to do that as soon as you can. That's how we're going to defeat the virus, and that's how we're going to get back to normal. Thanks for that, and over to you, Warden Cathy.
Great. Well, thank you so much for that, Mayor Holder. I spent a good part of the weekend reflecting on the news from Friday about the 215 lost but now found Indigenous children. I'm sure, like me, you were shocked, saddened, burdened, and yes, even angry. This discovery serves as a reminder that we cannot hide from a painful and horrifying past. We must acknowledge the pain and suffering we as a nation have caused to generations of our Indigenous communities. What is troubling is that this did not happen hundreds of years ago. This did happen in our lifetime. In no uncertain terms, we as a nation have played a role in this genocide. In order to move forward in reconciliation, we must acknowledge our role and as a nation, grieve the lives we have lost and the lives that we have changed for the worst. So I ask, if you haven't already, grieve, remember, and honor in your own personal reflections the 215 little lives that have been lost. Acknowledge what has happened and be part of a better future. While we cannot undo the past, we can be part of a present and future where we can do better. On the COVID front, I want to continue to encourage you to book your first shot, your first appointment for your first dose vaccine. As the mayor said, while many other parts of the province are able to accelerate their second dose appointments, we in Middlesex-London will not be able to until next week. When that occurs, if you are able to and you want to, take advantage of booking that second dose vaccine earlier. I had the opportunity to work at the pop-up clinic in Dorchester over the weekend, and so many that were attending the clinic were incredibly relieved to be there. So if you haven't, book your appointment. And I do want to thank the Middlesex-London Health Unit for arranging for that pop-up clinic in Thames Centre. It was greatly appreciated. Last week, I was pleased to announce that the Middlesex-London Paramedic Services has been able to secure 1,000 vaccines. And of course, this is in addition to the health unit's allotment. The MLPS will be concentrating at this time to working with various employers across the city and in the county to arrange for on-site clinics for employees. And I look forward to being able to announce firmed up details in the coming days. And now over to you, Dr. Mackie.
Thank you very much, Madam Warden and Mr. Mayor. Indeed, from a COVID case perspective, things continue to improve. Just over 20 cases reported yesterday. We know Mondays are generally low days because of the lower testing over the weekend, but all of that is very encouraging. Same encouraging numbers coming out of the provincial case counts, less than 1,000 cases today for the first time since March 5th. So big accomplishment, things continue to move in the right direction. We did have a banner day on Friday. We administered over 4,000 doses, 4,028 doses of vaccine. That's a new record set for the region, in part because of a new stress test that we were conducting at the North London Optimus Centre, where 1,500 people were vaccinated without much in the way of difficulties whatsoever. I want to thank the mayor and the warden for mentioning the mass grave that was found in campus. This is truly a tragic reminder of the atrocities committed in Canada. I note the warden used the term genocide. There has been a debate in Canada about whether we should use the term cultural genocide, which implies the erasure of a culture versus genocide. And I think this sort of discovery, while it shouldn't be surprising for anyone who has been looking into the history of residential schools, it certainly ends the debate. There's no further justification for denying that there was a genocide in Canada against Indigenous people. We will take a moment to remember those lives lost at 2:15. But before we do that, I'd like to pass to Dr. Dukelow for an update from LHSE.
Thank you, Dr. Mackie, Mr. Mayor, Madam Warden. I'd like to echo my colleagues' remarks about the situation in Kamloops that's evolved over the past few days. LHSE has joined our partners at the city in lowering our flags to half-mast. You may also notice that we've lit up the tower at Victoria Hospital in the color orange because of the situation at hand. Turning to COVID, as of this morning, we're caring for 30 COVID-19 positive inpatients, 11 of which are in critical care. Of those 30 COVID inpatients, the number of patients we are caring for from out of region is fewer than 5. I'm pleased to share, in keeping with what Dr. Mackie mentioned, the situation in Ontario is continuing to improve in our hospitals. We are experiencing some stabilization. While that is welcome news, we also acknowledge the sustained critical care pressures that our neighboring province of Manitoba is facing, and we anticipate we'll continue to receive a small number of patient transfers over the course of the coming week, as we did this past weekend. Cases that are received from Manitoba are reflected within our out-of-region patient status that is available on our public website. The current number is less than 5. As we continue to support the needs of patients from both within London and Middlesex area, as well as outside of our region, we are balancing our ongoing obligation to maintain and enhance critical care capacity with our work to gradually resume surgical volumes in a manner that is measured, safe, and sustainable. This week, we are continuing to utilize 10 of 15 operatings at UH and 14 of 17 operating rooms at Victoria Hospital. We are also moving forward with planning efforts to reopen our surgery center at the London Health Sciences Center, Victoria campus. We are hopeful as we look ahead to what the coming months will look like for LHSC and, more importantly, our community. We are thankful to our community for continuously supporting us by following the stay-at-home order, public health guidance, and getting vaccinated as soon as you are eligible. Our hospitals and emergency departments are safe. We are open 24/7 and ready to care for you. Thank you, and I'll pass back to Dr. Mackie.
Thank you very much, Dr. Dukelow. You may have noticed if you've been watching these broadcasts regularly that I have a picture in my background. It's an Inuit print from Ikutak Holman, and it shows a family with a young child. When Leslie White-Eye, former chief of Chippewa of the Thames Nation, came to speak at the Middlesex-London Health Unit. We had a town hall. This is several years ago when those town halls were still in person. And Chief White-Eye helped the staff of the health unit to understand the Truth and Reconciliation Commission findings and calls to action. And Chief White-Eye conducted an exercise with the group that took the child, a representation of the child, put it in the middle of the room, and chose some members of the staff to represent that child's family and arranged them around the child. And then she took the rest of the staff and arranged them around the family. What this symbolized is the importance of the child in Indigenous culture and the central role that the child has in the life of the family, and the central role that the child and the family have in the life of the Indigenous community. Chief White-Eye then took the child out of the center of the room and asked people to feel what it would be like for a family and society that is designed to support a child to have the child taken away. This art reminds me of that, how important children are, and how tragic every single life lost is in this country. I'd ask now that we take 1 minute silence to reflect on the Indigenous lives lost, the colonialism, and in particular, the 215 children who lost their lives at a residential school in BC. Thank you all very much for joining us in a moment of silence. And I'll turn back over to you, Dan.
Thank you, Dr. Mackie. And I know that we have some questions for Mayor Holder. Mayor Holder, I'm wondering if we can go to those right away for you. Randy Richmond at the London Free Press. As you noted, Mayor Holder, residents 80 plus in Middlesex-London region have to wait an extra week to begin booking second doses. Meanwhile, vaccine clinics in the GTA are saying they have lots of second doses available for that age group and are using Twitter to urge people to come get one. It's frustrating for residents of our region to see this kind of disparity in the vaccine rollout. How are you making the case for adequate supply for our region? With whom and how often? Is there resistance from the province to send us more?
Well, thanks, Randy. Look, I know it's extremely frustrating for seniors in London Middlesex. The decision, I believe, to support GTA first has everything to do with it being the most significant hotspot in Ontario. The province, in my view, is not particularly discriminating against London and Middlesex. I think it's going where the greatest need is at this time. I've certainly had discussions with the most senior people in the province. And what it comes down to, as I have been told, is that it's an issue of vaccine supply. If they had the vaccine supply, we would be in a position to more than make up our shortfall that we know exists. We've talked about that over the last number of meetings, perhaps the last couple of weeks particularly. And we know it exists, they know it exists. The reality is, if they get the doses, we will get the doses. And right now, they're trying to deal with the most significant hotspot in the province.
Thank you, Mayor Holder. And Randy does have a quick follow-up. Mayor Holder, another question for you, if not asked, well, it hasn't been asked earlier by others. Here we go. Mayor Holder, can you provide more details about the group of 25? Where and when and why were they gathering?
Randy, again, we don't have the details as yet from our bylaw enforcement folks. They indicated there was one specific group. I can't tell you young people, older. I don't have those details as yet, but as soon as we've got those details, we will make them available to everyone. It does make the point, though, that it doesn't matter who they were, frankly. We will, the appropriate response will be made. But we just have to have people be a bit more thoughtful for the long term. And, you know, people have been so good for so long, and we know that the weather's getting better. We know that people want to socialize. Oh my gosh, we know that. And we're just asking people for just a little tolerance, a little longer, so we can get through this that much sooner, because the opposite is also true. If we don't do this, then we are going to be in it for the long haul, because it will be the long haul as we work through this. You know, we've still had too many people get COVID. Our numbers in the last couple of days have been, and several days have been pretty great. But that's because people have been adhering to the rules. So we want to keep that going for everyone's sake. So.
Thank you very much, Mayor Holder. Let's go to our next question. This one is for you, Dr. Mackie, and it comes to us from Nick Paparella at CTV London. Dr. Mackie, lots of confusion among seniors 80 plus today, thinking they could rebook in Middlesex-London as of today. Is it frustrating when the province says one thing, but the lack of vaccines prevents this area from being able to get those seniors in earlier?
Yeah, thank you for the question, Nick. I think it's fair to say that it is frustrating. You know, the decision to rebook seniors, although it was made at the provincial level, is not actually functionally possible in many places, even those who are using the provincial booking system, because those appointments are all booked out for the booking period of the next 4 weeks. So, you know, I have to admit, it is a head scratcher. The problem seems to be that there's more vaccine than needed in the GTA community for first doses. I just don't know why the solution isn't redistributing those vaccines to those that need it most. I'll just briefly share my screen here, because there's some interesting new data. Over the last week or so, the rate of COVID-19 in Middlesex and London twice crossed over that of Toronto. That's the first time in my memory that we've seen that. Just checking in with Dan, can you see the chart here?
We can see it, Dr. Mackie, thank you.
This is from the provincial website, covid19ontario.ca data. You can choose the health units here. In pink, I've chosen Middlesex-London, and purple for Toronto. These are cases per 100,000, so not total cases. Obviously, there are more total in Toronto, but cases per 100,000, you know, the rate in Toronto over the last month or so has really dropped and is now on par with that in Middlesex-London. And on May 26th, and then again on the 29th, our rate was actually higher. So I think it's fair to say that the hotspot strategy either needs to be updated or has outlived its usefulness. We need those vaccines here. You know, there was another request that came through today that was quite confusing. The province is now doing an inventory on syringe tips. There are shortages of the needle part of the syringe. Province is looking across Ontario to see where might there be extras and willing and able to help facilitate redistribution of those needle tips if needed. Completely understand that. We're on board, we'll participate. We just don't understand why the other side of that isn't happening, and redistribution of things like vaccine doses are not going to those communities that need them most.
Thank you very much, Dr. Mackie. Let's go to our next question. It comes to us from James Sims at the London Free Press. Dr. Mackie, we have consistently over the past few weeks heard that the virus has spread more among adults under the age of 30. However, we are hearing that children between 12 and 17 are being given second dose appointments at the end of July, while people 18 and over have second doses booked in September. We know second dose appointments will likely be moved up, but why are children getting priority spots over young adults?
Yeah, it's a great question, Jane. The reason is school reopening in the fall. The government wants to have second doses in arms in time for children to have full immunity prior to the reopening of schools in the fall. I think, you know, given the importance of schools in our functioning of our society, which has really been highlighted over the last year and a half of the pandemic, you can completely understand why the safe reopening of schools be made a priority here. Unfortunately, this is, you know, like many of those questions of rationing that we've had to face over the course of the pandemic, something where if your strategy is to support one group, it means it has a potential impact on another. So the only other thing that I'll add is that we will likely have lots of vaccine in the coming months, and so it's quite possible that those younger adults may see their second doses moved up as well, as you're seeing with the 80-plus crowd happening across the province and here soon. So hopefully we'll be able to get everyone's second doses around that same time frame.
Thank you very much. Next question comes from Andrew Graham at Global News Radio, 980 CFPL. And Dr. Mackie, this one is for you as well. Dr. Mackie, the MLHU said this morning that those 80 and older looking to rebook their second dose appointment will be able to do so by June 7th. What is changing between now and then that will allow that?
Yeah, the main thing, Andrew, is we're really pushing now to try and support young people, young adults, and the children over this sort of last week and this week to make sure they have a chance to book first doses. You know, I think virtually all commentators agree that the first dose is the most important dose. The second dose absolutely has to be in the arm at some point, but the first dose conveys a large portion of the immunity. Again, it won't last unless you get the second dose. Second doses are still important. But so, you know, we're continuing on with that first dose strategy. And as soon as we have enough coverage among that young group, for first doses, we'll move to second. Tomorrow night and Wednesday night, we will be hosting town halls for conversations with families in the public board and the Catholic board, as well as the French language boards and private schools, so that we have a chance to really support parents to make a good evidence-based informed decision about vaccinating their children. We are anticipating an increase in uptake associated with that. And as we see how those bookings unfold, we'll be able to move to rebooking the 80 plus. We do, you know, there is a possibility we may be able to do that by Thursday, depending on how things go. We'll be watching closely, and we'll have another verbal update at the media briefing on Thursday.
A follow-up question from Andrew Graham for you, Dr. Mackie. How were things at the two-day vaccine clinic set up in Dorchester? We expect to see similar clinics in the future.
Yeah, things went really well. The booking happened quickly, and the warden mentioned that she was able to get down there. The mayor of Thames Centre, Alison Warwick, and the deputy mayor, Kelly Elliott, were both able to attend and help with the process. They volunteered to help move things around there. So thanks to them as well for that. You know, this is exactly where we need to be moving over the next few months. The mass clinics are still the workhorses and will likely for the foreseeable future be the main delivery source. But we know that getting out to different locations in the county, as well as underserved areas in the city, will be an important part of reaching marginalized groups. And we're absolutely putting that in place as we speak. In a school strategy in particular, we have designated 2 mass clinics to be the primary delivery mechanism for the schools, but we'll be out in the county schools supplementing that in partnership with Middlesex-London Paramedic Service, as well as some of the underserved schools in the London area. So, you know, that's a big part of the next phase of the vaccination strategy.
Thank you very much, Dr. Mackie. Let's go down to a question from McKinley Leonard Scott at the Middlesex Banner. This is for Warden Burghardt-Jesson and any others who would like to answer. Madam Warden, on Friday, I took the Voyago shuttle bus from Strathroy to my vaccine appointment. They said I was the only rider they've had. Have you heard any concern from residents about transportation to vaccination sites? The second doses ramp up. Do you expect the bus will get more use?
Well, thanks for that, McKinley, and I'm glad that you took the shuttle. It doesn't surprise me that you were the first one to take advantage of the shuttle transportation service that we've rolled out. You have to remember, it is in its infancy, and we just announced it in the last week to 10 days. I do suspect, as word gets out and social service agencies work with different community groups, that there will be uptake. This is something that our communities have asked for, and I have every confidence that as the days, weeks, and months go on, that it will be a valuable service that will be used by our residents.
Thank you very much, Madam Warden. Dr. Mackie, do you have anything you'd like to add?
I don't think so. And well, maybe a thanks to the Warden and Middlesex County for working with Voyago to set that up. It's you guys are tremendous partners through all of this.
Thank you very much. And thank you, Madam Warden, for that response. That does bring us to the end of our questions for today, and we are going to call it right there. We want to thank you very much for your participation. We want to thank you, Dr. Dukelow, Warden Burghardt-Jesson, Mayor Holder, and Dr. Mackie for all of your insights and your comments today, and for a powerful reminder about the effect of residential schools and colonial institutions on the lives of Indigenous people across Canada. A very powerful and important message this afternoon. Our next virtual media briefing will be on Thursday afternoon at 2 o'clock. We do hope that you will join us then. Between now and Thursday afternoon, we hope you have a great rest of your Monday. We'll see you on Thursday, and so long for now.